Thank you so much for joining us. This is the fourth session in our year-long series of learning. My name is Danielle Hubley, and I manage advocacy and education with the Partnership for Strong Communities. The partnership is super excited to be hosting this series. We've prepared a wide range of conversations with advocates and leaders in other sectors to talk about the impact that a lack of safe, affordable housing has on the work that they do. Before I get into more information about the partnership and today's topic, I just want to make sure to remind you that this series is taking place on the first Wednesday of every month, starting from February all the way through October of this year. If you're sad that for whatever reason we don't have a session planned in November, don't be, because we are hosting our annual Affordable Housing Conference in November. It'll be the 18th and 19th this year, so please plan to join us. It is fully virtual, totally free, but that'll be a great opportunity to build off of the learning we've been doing here and dive into some other affordable housing topics. So that's what we'll be doing in November. Some quick housekeeping before we dive in. Today's conversation is being recorded and will be made available to our YouTube channel under the Partnership for Strong Communities. We can share a link to the playlist in the chat so you can see some of the conversations that have already taken place and continue to be tuned into the conversations if you're not able to make any in the future but want to be plugged in. Additionally, if you have any questions, please use the chat box at the bottom right-hand side of your screen to add to the conversation, ask any questions you might have. We'll aim to get through as many questions as possible, but we only have an hour this morning, so we'll do our best to get through what we can. But I know that the presenters will share their contact information, so you can get in touch with them beyond today's conversation if we don't get to your question or you come up with something later that you want to ask folks. So with that, let me first introduce you to the partnership and why we're hosting this series. So the Partnership for Strong Communities promotes equitable change in Connecticut housing policy by coordinating advocacy, advancing research, and uniting diverse partners. Our vision is that everyone in Connecticut has a safe, stable home that is affordable to them in an equitable community of their choice. Our mission is carried out through our partnerships. We are committed to policies and practices that reduce disparities in housing and within our organization. We ground our works in fact and data, and we prioritize housing solutions that will be affordable and sustainable in the long term. We believe that housing is a human right. So how do we actualize our vision at the Partnership for Strong Communities? We focus on a healthy housing system, which necessitates a comprehensive approach, intertwining housing affordability, creation, choice, and stability. We know that people need to afford their homes while meeting their other basic needs. We know that we need more physical homes, period. And we need all different kinds of homes for people to choose from in all communities across their state, across the state, and across our state. And people should have the right to safe and stable homes and be supported from the experiences of housing instability, eviction, and homelessness. This is really how we are weaving a housing system that prioritizes the needs of our residents and that supports stronger families and stronger communities. And today's conversation will predominantly focus in on the priority of housing affordability. I recently heard someone share that one thing people don't often think about is how being homeless or housing insecure impacts your food choices. Do you have a place to store foods long-term? Will you be able to use them before they go bad? Do you have access to the tools you might need to prepare different foods? Do you have the money to afford healthy options for food in the first place? We know that with the cost of food and rents rising rapidly in the state and across the country, and wages are also stagnating for workers, there are many households in the state who are grappling with the choice of putting food on your table or having to pay your rent that month. And that's really not conducive to stability or equity or access or creation or choice, any of these issues that we're dealing with. But really this affordability bucket is where we're kind of honing in today. So broadly speaking, this word cloud was generated at our 2023 Affordable Housing Conference this past November, where we asked attendees to share the different words or phrases that describe what a thriving community looks like to them. What you see here is a culmination of about 81 different responses from attendees, and this really shows us that a thriving community is inherently an intersectional community. Intersectionality is a framework for conceptualizing a person, a group of people, or social problem as affected by a number of influences. It takes into account people's overlapping identities and experiences in order to understand the complexities of the experiences that they are facing. When we think about building thriving communities, like I alluded to before, we need to think beyond just the lack of available housing options. We need to think about the accessibility of food, clean water, healthcare, green third spaces, as they're sometimes referred to, school systems, various services within the community, diversity within the community. Nothing exists in a vacuum, especially not housing. And that's really why we're hosting this series. So as we think about the intersectionality of the conversation around housing, it's really important that we also acknowledge the inextricable link to the land that we build and live on. While there's a lot of work for us still to do regarding addressing our history and the impact it has left on many families in our state, here's one place that you can learn a little bit more. I'll have Michelle drop a link in the chat to nativeland.ca is a great resource to get started and learn a little bit more about the tribal communities, the land that you're living on and the history of it, and what it means to our tribal nations. So now that you know why we're here, it is my pleasure to introduce you to Aubrey, Stephanie, and Deidre, who will share a little bit more about their work and how it intersects with how food and housing intersect together and how their work ties into this conversation that we're having today. But I really want to give as much time and space to our presenters in the hour that we have. So I'm going to kick it off to Aubrey to get us started. And I'll stop sharing my slides so you can pull yours up and take it from there. Thank you so much for joining us, everybody.
Thank you, Danielle. Let me just share my screen here. So good morning, everyone. Thank you so much for joining us. My name is Aubrey. I use she, her pronouns, and I serve as the director of Connecticut Foodshare's Institute for Hunger Research and Solutions. I am joined today by my colleagues and co-presenters, Deirdre DeCara, the executive director of Friends in Service to Humanity of Northwestern Connecticut, and Stephanie Boyce, Director of Homeless Prevention, Outreach, and Food Access Programs at Hands on Harvard. And today we'll be discussing the intersections of affordable housing and food insecurity. Many resources will be shared throughout this presentation and will be added to the chat. You may notice some comments and chats from my colleague, Olivia. And in addition, a copy of this presentation will be released with a recording. So as a way of introduction, Connecticut Foodshare is the food bank serving residents in all 169 towns here in Connecticut. Our mission is to deliver an informed and equitable response to hunger by mobilizing community partners, volunteers, and our supporters with a vision of a thriving community free of hunger. We are committed to providing our neighbors with food for today and helping them achieve food security for the future. As director, I lead the Institute for Hunger Research and Solutions, which provides the food bank and the partner program network to transform our charitable food system to ensure it is supportive, dignified, and convenient. The Institute provides resources, trainings, technical assistance to support the partner programs to increase access to nutritious, culturally connected foods, bolster neighbor engagement, and create meaningful connections to non-food resources in the community to increase economic security. So to level set our conversation today, I like to start off with the definitions of hunger versus food insecurity. A lot of times I see these words being used interchangeably, but they do not mean the same thing. Hunger is a feeling that someone has when they don't have food. We have all experienced the feeling of hunger. You're rushing out the door in the morning, you forget your breakfast, you forgot your lunch, now you've skipped a meal and you're hungry. On the other hand, food insecurity is the consistent lack of access to affordable and nutritious foods. So here in Connecticut, 1 in 10 residents are experiencing food insecurity, not knowing where their next meal is coming from. So this equates to 380,000, about 400,000 people here in Connecticut. And for children, unfortunately, 1 in 9 Connecticut children are experiencing food insecurity. And food insecurity can present itself in a multitude of ways. It may mean that some family members are fed, but there's not enough food to go around the table for everyone. So for example, parents, caregivers, elder siblings may go without eating for that day to ensure that the younger siblings or the senior family members are able to eat. It may mean that a family is fed, but there's not enough food on their plate. It could mean that the family has enough food, but it's not adequate, it's not nutritious, it's not culturally connected, it's not foods that they would like to be eating. Or it could mean that the family is fed for part of the week or part of the month, but run out of food before the month is over. And here in Connecticut Foodshare, we recognize that food insecurity doesn't occur by chance. It is not the way of the world that some people have access to all the culturally relevant, nutritious foods that they need and others go without. This is a result of a number of deeply systemic racist inequities and environmental factors that we refer to as root causes. And you can see some examples of root causes of food insecurity here on the slide. So things such as stagnant wages, lack of access to nutritious food, unaffordable healthcare, unaffordable housing, limited access to transportation. And unfortunately, these inequities also disproportionately impact people of color and other marginalized groups. And the unfortunate truth is that for many people in the state across the US, they struggle to meet their basic needs, which increases their risk of food insecurity. So, for example, layoffs at work, unexpected car maintenance, a sudden accident can suddenly force a family to have to choose between paying for food and paying their bills or housing costs. And when we consider the lack of affordable housing as a barrier to accessing nutritious foods, we also have to consider geography. There are areas known here in Connecticut as well as nationwide as food deserts, where food resources in the area are limited. Food deserts are prevalent in rural and urban areas where it's very common to live far from a grocery store or food assistance program. And other barriers like limited access to public transportation make it inconvenient to obtain nutritious and affordable foods. There are also areas known as food swamps that have limited access to affordable, nutritious foods, but are saturated in unhealthy options like fast food chains and convenience stores. For example, I live in Meriden, Connecticut. And so for me to access fresh, nutritious foods at a grocery store or a farmer's market, I have to get into my vehicle and I typically have to drive 15, 20 minutes to access my nearest grocery store. Uh, Whereas if I within walking distance from me, if I walk up and around the corner from my house, there is a Chick-fil-A next to a Chipotle, next to a Dunkin', next to a Panera, next to a Chili's, all in one big strip. So in a food desert, it becomes difficult for residents to find nutritious food, leading to food insecurity. And in a food swamp, residents don't have difficulty finding food per se, but it's often food that is cheap and unhealthy. And food insecurity is not just about whether a person has enough food for a day, a week, or even a year. It impacts pretty much all other aspects of their daily life and is linked to a variety of negative long-term outcomes. It contributes to poor nutrition and poor health outcomes because people aren't getting the food that they need to fuel their bodies. It can lead to serious diet-related diseases like high blood pressure, high cholesterol, heart disease, diabetes. It can negatively affect psychological and behavioral health, starting in youth, starting in adolescence. And in children, food insecurity affects the mental and physical development, making it more difficult for a child to learn and grow and concentrate when they're in school. So this graphic that you see here, provided by Feeding America, shows the cycle of food insecurity's impact on health. A person experiencing food insecurity will often use coping strategies to help them get more food. And research shows that about 79% of people experiencing food insecurity cope by purchasing inexpensive, unhealthy food, and about 40% of people water down their foods or drinks to make their food last longer. Now, these coping strategies have a direct impact on health, especially diet-related illnesses. Research shows that 33% of people who visit food pantries have a household member with diabetes, and about 58% have a household member with high blood pressure. And as chronic disease risk rises, so does healthcare expenses, as folks need to visit their healthcare providers or may end up in the hospital more frequently. Now, their employability, their ability to maintain and sustain their employment is declining as their health declines because this may be impacting their attendance at work. And as the medical bills and the cost of necessary prescriptions rise, so do spending trade-offs. So now individuals and families have to decide between paying for their medication or food, paying their rent in full, or being able to afford nutritious, healthy foods that their families actually want to eat. So food insecurity is inherently stressful. When you're trying to figure out where your next meal is coming from or what spending trade-offs to make, it can be a very traumatic experience. I saw a quote from a college student recently that said, when one isn't able to afford food, it makes you frustrated and angry at the macrocosmic institution of society that should be offering healthy food to people who need it. Anger and frustration are certainly there. Then what comes from that is a sense of regret, sadness. It's the feeling that one is not worth food. And food insecurity is everywhere. In almost any Connecticut community, you can find a food assistance program, even in the wealthiest of communities. For example, Greenwich, with a median income of about $180,000 a year, about 9% of their residents are experiencing food insecurity. Again, not knowing where their next meal is coming from, having without reliable access to affordable and nutritious foods. So this map that you see here has been provided by Connecticut Foodshare's Data and Impact Team, really shows the food insecurity rates by town. The darker the green, the higher rate of food insecurity. And notice that both cities and rural areas have higher rates of food insecurity in our state. This may be due to the geography, as we just discussed, food deserts and food swamps, which tend to impact folks' ability to be able to access fresh, nutritious foods at the grocery stores versus having access to cheaper, less healthy fast food. So while we acknowledge that food insecurity impacts everyone, regardless of race or income, we also recognize that racial and ethnic disparities exist here in Connecticut as well as nationwide. These systemic inequities contributing to the root causes of food insecurity that we discussed earlier disproportionately impact people of color and other marginalized groups. So according to 2021 Feeding America data, 22% of Hispanic and Latino Connecticut residents are experiencing food insecurity. 21% of Black and African American Connecticut residents are experiencing food insecurity, compared to 6% of white Connecticut residents who are experiencing food insecurity. And the food insecurity rates map that I showed on a previous slide is actually an interactive map that provides data for each of the 169 cities and towns here in Connecticut. So here are 3 examples of the data you might find on this resource based on the towns that our presenters are from: Wallingford, Torrington, and Hartford. Now you may notice that there is a difference in the food insecurity rates, the poverty rates, the median incomes, the whole number rates between the 3 areas. And although each town in Connecticut faces different rates of food insecurity, the myths about food insecurity overall and those who are experiencing food insecurity persist statewide. So there is an unfortunate misconception that still exists even now in 2024 about those who are experiencing food insecurity, those who are accessing food assistance programs, those who are accessing eligible services, federal services like SNAP, WIC, housing assistance. And these assumptions and misconceptions are often that these folks are not employed, they are undereducated, they are comfortable just receiving services from the state. They're okay with wanting to live off the system. And quite frankly, none of that is true. Many food insecure households are considered part of the ALICE population. ALICE stands for Asset Limited, Income Constrained, and Employed. And these are individuals who are earning more than the federal poverty level, but not enough to afford the basics of where they live. Some examples of folks who are in the ALICE population include cashiers, personal care aides, truck drivers, teachers, registered nurses, food service workers, who aren't paid enough to support themselves and their families. And these folks that I just mentioned, especially during the height of the COVID-19 pandemic, they were applauded. They were our essential workers. They were our frontline heroes. They were doing the jobs that absolutely nobody wanted to do, especially during that time. But unfortunately, they were unable to support themselves based on their stagnant wages. So according to the United Way, who provides this ALICE report every few years, about 48% of Connecticut's food insecure families do not qualify for federal programs like SNAP, like WIC, like the Emergency Food Assistance Program, which then influences how these households are forced to have to make tough choices, having to decide between quality childcare or paying for food or paying for their rent and their utilities in full. So you'll notice this table on the right-hand side is based on the 2023 United Way's ALICE report, where they estimate every few years a ALICE household survival budget, as they call it, including the minimal cost of household essentials. And you'll see those essentials listed here: housing, food, transportation, childcare if they have children, healthcare, the very basics that all of us need to survive here in this state and across the nation. But you'll notice it doesn't mention anything about savings, car repairs, travel, dinner at a nice restaurant. This is just the bare minimum basics. So the United Way estimates that for a single adult with no children, by the way, they need to be making at least $16.56 an hour in order to survive here in Connecticut, to be able to afford the basics that you see on this screen. The minimum wage here in Connecticut as of January 2024 is $15.69. So that's almost $1 short of what folks would need to be making in order to survive here in Connecticut and afford just the basics. And for a family of four, so now we're talking 2 adults, 2 children, the United Way estimates that that family needs to be making at least $53 an hour, which comes to about $100,000 a year. So for a family of 4, not a family of 6, not a family of 8, not a household with extended family, just 4 individuals to survive here in Connecticut, the United Way estimates that that family would need to be making at the bare minimum $100,000, which we all know is not the reality of a lot of folks who live here in Connecticut. So because of this, we find that many of the families and individuals that we serve at Connecticut Foodshare are part of the ALICE population, often working multiple jobs to make ends meet and are still faced with having to make spending trade-offs. And these harmful misconceptions and assumptions about those who are accessing free food, free services, regardless of their income, makes it all the more harder for folks to ask for help. Asking for help and accessing free services can be a very traumatic experience within itself. And many times folks will choose to suffer in silence than ask for help because they're worried about the judgment that they might receive from those on the outside looking in, but unfortunately, sometimes even from their own family and friends who don't understand why it is that they may be struggling to afford the basics and live in this state while working 1 or 2 or multiple jobs. And one of the reasons that households have to make these trade-offs when it comes to paying for essential costs is being overburdened by housing costs. When the cost of housing exceeds 30% of a household income, it is considered to be a burden. So if a household is spending over 50% of their income on housing, they are considered severely cost burdened. And according to America's Health Rankings, 40.2% of households with housing costs are cost burdened. And as you can see on this map on the right-hand side, the cost burdened renters, this information is provided by Data Haven, in urban areas have a higher concentration of cost burdened households, but they exist across all towns. And this concentration of cost burdened household actually looks quite similar, if you remember, to the map of food insecurity rates that I showed you earlier, where the darker the green, the higher rate of food insecurity. Here, the darker the blue, the higher rate of cost burden. And if we were to overlap these maps, there would be a lot of similarities where rural and urban areas are often the areas with the highest rates of these types of issues. And when we look at the map on the left-hand side, we see that there are not nearly enough affordable or available housing units for households making at or below the area median income or extremely low income. So this actually equates to a lack of about 185,000 affordable and available housing units for these two specific income groups. So on average, 80% of these two groups are facing a cost burden. And when the cost of available housing far exceeds the household income, folks are then forced to make difficult decisions yet again. They may choose to live in substandard housing, fall into homelessness, or seek housing farther away from their job, again, possibly risking their employability, especially if there isn't access to reliable public transportation in their area. So like housing, food is a permanent need, but food may be the first trade-off because supplemental resources or coping strategies may be more accessible. So eating smaller meals, skipping meals, watering down meals to make them stretch longer, or visiting a local pantry. Next, we will hear from my colleagues, Deirdre and Stephanie, who will provide a deeper understanding of the housing burden here in Connecticut. So to introduce my colleagues, Deirdre, the Executive Director of Friends in Service to Humanity of Northwestern Connecticut, also known as FISH NWCT, an organization dedicated to providing the most basic of human needs: food, shelter, and hope. She has provided leadership at FISH since 2013. Deirdre is well known as an advocate and champion for youth, the homeless, and the food insecure, a community leader representing nonprofit organizations, and an organizer of the community events and fundraisers. In the recent months, she has been focused on presenting an RFP to the town of Winchester and Wednesday to purchase and renovate the bachelor's school into affordable housing units. Deirdre is a lifelong resident of Winchester and is a graduate of Wheaton College with a degree in urban studies. Stephanie Boyce, LMSW, is the Director of Homeless Prevention, Outreach, and Food Access Programs at Hands on Hartford. She received her undergraduate degree in social work from Central Connecticut State University and her graduate degree in social work from the University of Connecticut. Stephanie brings over 10 years of nonprofit experience and providing services to individuals in the greater Hartford area. In her spare time, she enjoys reading and spending time with her friends and family. While these folks are presenting, we do encourage you to type questions into the chat or hold on to your questions, as there will be time for Q&A at the very end of the presentation.
Thank you for welcoming me, Aubrey, and welcoming me to share in this webinar organized to sound our alarm that food insecurity can definitely be correlated with those facing a housing crisis and the need for affordable housing in Connecticut. My message is one of resilience, of changing our way of work and adapting to a post-COVID world, and of recognizing that we need to collaborate and partner with other service providers to help our neighbors in need and not to work in a silo. I'm going to introduce, come on over. I have with me my food pantry manager, Margaret Franzi.
Good morning, everybody.
At FISH, Friends in Service to Humanity of Northwestern Connecticut, our mission is to provide the most basic of human needs: food, shelter, and hope. And since opening our doors in 1972, FISH of Northwestern Connecticut has evolved into the largest emergency homeless shelter in the Northwest Connecticut corner, providing families, individuals, and veterans a safe and secure haven, as well as serving the residents of area communities as a food pantry. Our goal at the shelter is to provide a friendly communal family setting to neighbors in need. We serve infants through seniors. Currently, we actually have 3 newborns here, born since July. The programs and social services at FISH are critical to some for their survival and well-being. Today, amazing things happen for people under the roof at FISH. We strive to serve those area residents in economic crisis and distress, facing life changes and homelessness. Have you ever thought of what courage it takes to ask for help if one is homeless or food insecure, or how scary it may be? I suggest we take the mystery out of being homeless, realize that every individual has their own unique story, and there should be no stereotyping, and that we truly are serving our neighbors in need. Hopefully their situation is short-term, and we can be glad that we have given them a helping hand with a smile. Fish is a supportive, low-barrier shelter model. Now, last year at the Fish Food Pantry, we distributed enough food to provide 180,000 meals to our nearly 700 registered families, representing 1,700 individuals. And at the Fish Homeless Shelter for families, veterans, and individuals, we have 35 beds, 5 of which are dedicated to veterans. We served 56 adults, 17 children, and 12 veterans, to total 85 residents. Our shelter residents receive meals, bedding, mental health and medical assistance, and GED classes if needed. They have case management to coordinate services, connect to resources, and assist with job search support and vocational training as they await permanent supportive housing placement. Know that we used to serve over 100 homeless annually, yet we have a lack of affordable apartments today to make that possible. People are just not moving out quickly. We have emerged from the dark days of the pandemic resilient. Imagine that we did not have a case of COVID in our congregate housing shelter for 2.5 years as we followed our Team Stay Healthy guidelines at both the Fish Shelter and Food Pantry. Yet we have experienced much change, and our mission of providing hope has increased many-fold. Since the pandemic, at the Fish Food Pantry, donations from large food drives have nearly vanished, yet our need grows daily. Food is flying off our shelves, and to supplement our weekly deliveries from Connecticut Foodshare, Food Rescue, and other wonderful donors, I'm now writing grants to purchase food. And in the last 6 months, our number of clients have increased by over 600 people, and we have now grown to over 1,700 people at the food pantry. And what are we observing? Clients that we have served who step forward, usually in tears, that ask for help because they are being evicted from 2- and 3-family homes, apartments, that they may have lived in for over 30 years. And I believe you are all well aware of this, that post-COVID landlords have greatly increased rents, and those living on a retirement fixed income and families with underfunded wages are facing homelessness. At Fish, we are fortunate to partner and collaborate with others who assist us in serving our pantry clients facing a housing crisis. Yet for other food banks and pantries, this may be where we need to adapt and change and find ways to bring in other resources and learn how to refer those asking for help beyond food. I suggest we all work with our communities, our town leaders, our legislators for support. We need to connect with other organizations to address the legislature in an organized, united effort, all for affordable housing. Every town in Connecticut needed to adopt an affordable housing plan in 2023. So let me just look at these slides with you, and then I want to share with you my own story of volunteering and walking the talk. So I know we've moved ahead on some of my slides, so I hope that, okay. So enjoy the slides when you get your copy, and I'm moving forward now to in Northwestern Connecticut. The slides that are in my presentation are from 211 and also the Connecticut Coalition to End Homelessness, which I work with on a constant basis. So this shows in Northwestern Connecticut that we experienced 450 people in a 2-week period looking at this that are homeless. I mean, Litchfield County is supposed to be one of the most affluent areas of our state. And yet we are facing longer lines and really people who never imagined facing homelessness because they are losing their affordable housing. So this is a breakdown. You can see it by households, by children. Last fall, I learned through Ed Advance that there were over 40 families that were homeless. And so we made room in the fish shelter. We have a 2-family house next door to keep families united. And then we have congregate dormitories. We have 1 small room, which has a mom and a baby right now. But we also brought in 2 other moms with girl children for the women's dorm. You don't want that for people. I mean, but we adapted so these poor folks aren't stuck living in their cars, living in tents. And imagine the bear population here in Northwestern Connecticut. I will tell you, we have people that will come into shelter to say how bears regularly were coming daily into where they were camping out until they got into shelter. So I find these statistics just absolutely unacceptable in our state. And when Aubrey shared that wonderful map of Connecticut with food insecurity rates, here's picturesque Litchfield County. And in the town of Winchester, Winstead, which is my hometown, over 14% of the people are food insecure. In Torrington, over 13%. In Litchfield, 8.9%. I mean, that's just not acceptable. Norfolk, which is a beautiful idyllic community with the village green, over 10% of their people are food insecure. And Morris, this lovely little town, just had to open their own food pantry at 14% of their folks are food insecure. So in the Torrington area where we are located, but we serve the whole Northwest corner for a shelter and anyone needing food. We have a population in Torrington of 35,000 people. Over 13% are at a poverty level, and over 13% are facing food insecurity. Now, the median income, they say, is 63%. Of course, that's not what we're seeing here. We see people at the poverty level at Fish. But working with the Connecticut Coalition to End Homelessness and having worked with legislative rallies and other means to cry the message of poverty in Connecticut and the need for housing, we know that just a survival budget, you need at least $54,000 a year. My own staff are underfunded. It is so upsetting to face that. So this slide is the Be Homeful for the holidays. It says homelessness. This is a little old because it's 13%. Right now, we're seeing 14% increase in homelessness in Connecticut right now. So now I want to share, the next slide will be my special project. And I'm very big on, I volunteer, I serve on several boards of directors, and I'm very big on serving our community besides my own career work here at Fish. And in 2000, I started on a project, and a group of citizens created the Northwest Senior Housing Corporation, a nonprofit, and we built the Susan M.B. Perry Senior Housing next door to the Winstead Health Center. We managed to have $1 lease a year, which we don't actually pay, but we have a beautiful 20-unit housing, and it's a HUD 202, which means it's low-income senior housing. And for some of the folks, they'll share, this is the nicest place I've ever lived in my life. So with that excitement still, we cut the ribbon in 2008, and I'm still the treasurer of that organization, and we meet monthly and are very active with our residents. So I said to my board, I think we need to do another project because I'm seeing daily at my work at Fish, the desperation for affordable housing. And knowing that in 2023, that we had uh, every town in the state of Connecticut had to come up with new affordable housing plans to serve their residents. So certainly Winsted needs more affordable housing, the town of Winchester. So we learned of the Bachelor School, which was my grammar school, had closed the year before, and the Board of Selectmen put out an RFP, and anyone could apply. And so we created a new 501c3, which we call Winchester Housing Partners, which I'm chairing, and I have a group of very dedicated volunteers working with me. We received our IRS status in January. So we already have fabulous architect plans, and we're going to open with 37 units of studio, 1-bedroom and 2-bedroom apartments in the Bachelor School. And I hope we cut the ribbon within 3 years. So that makes me think, gosh, Connecticut really needs to work on where are we going to be putting our folks that are being displaced right now? Because if it takes 3 years to build affordable housing, we do have a crisis, and we don't want the trauma of people having to go into homeless shelters. But you may think, oh my gosh, I don't know anything about building, but I will tell you that I surround myself with wonderful experts who are there to help any volunteer group in a community to build affordable housing. So I'm very excited, and I hope that you'll look at your own hometowns on ways to help those facing homelessness or eviction. So thank you.
Thank you, Deirdre. All right, Stephanie.
All right, thank you so much. I'm so happy to be here with you all today. Just a quick little some information just about Hands on Hartford. If you want to go to the next slide. For those of you that know, we are a smaller nonprofit here in Hartford. Our mission is in partnership with others, strengthen community in Hartford by responding faithfully to people in need through programs that change lives and renew human possibility. Next slide. So before I just get into kind of what we're seeing in our program, just a quick little fact about Hands on Hartford is we were founded in 1969 by a group of churches in Hartford who saw a need in our community to be able to start by providing different meal programs for folks. So we're very fortunate enough for all of these 55 years we've been in existence to continue to serve our neighbors through our Manna food programs. One program that we continue to have is our community pantry. We are seeing, similar to what Deirdre said, their food pantry, their numbers went up. We are now serving over 1,000 households a month. And that number has doubled. Back in 2021, we were serving maybe like 650. 2022 went a little bit up. 2023, that's when it really started to go up, right? We saw there needs to be a continued an increase in need here with our community. We also, and one thing too that Danielle pointed out was earlier in her part about how the impact of food choices, right? Do households have the means to prepare food? Do households have access to healthy options? We make sure every month, right, because households can access our pantry once a month, that we are giving out milk, eggs, and fresh produce. That's something very, very important to us, as well as participating in the SWAP program, which is supporting wellness across pantries. So folks are making those healthier choices when it comes to food. We also bring in health services too to our Center for Community here. We have student nurses checking on blood pressure, blood sugars. We have Hartford Healthcare, their neighborhood healthcare on site twice a month. So really trying to make sure when folks access our programs, not only are they accessing that food, but they're also accessing that health component too, that we know is so vital to our community. We also, a program that also touch base on is our backpack nutrition program. We are serving right now about 225 students here in the Hartford community throughout 8 schools. So, right, we're supplying some healthy food options for them for the weekend. In a recent survey, what we learned is that almost every student who has a sibling with them in their household, they're sharing their food over the weekend with their sibling. For me, that just shows how telling how the need is, right? What the need is in our community. Yeah, we can go to the next slide. So here at Hands on Hartford, we also are open every single major holiday meal. We open for the community. It's free. Folks can come in, get a really nice restaurant quality meal. And I'll say those numbers, they increased every single year. Our numbers have gone up. I'll say this past Christmas, we served over 500 households. So that was really great. Like, we're really happy that we're here meeting the need, but it's so telling of, again, I can't stress enough the need in our community for access to food. Okay, next slide. One thing that we decided to do a few years ago is we decided to open up Gather 55 which is a participation model style restaurant where folks can participate by paying the full posted menu price, paying a minimum of $3 towards their meal, or volunteering on spot for 30 minutes. We have seen, I think last month, when I looked at the numbers, we had 500 individuals volunteer their time for that meal. And it's a healthy restaurant quality meal for folks who are looking to access that program. Next slide. We know too, I think, Danielle, Aubrey, Deidre touched about it, how, for folks who are living at that ALICE threshold, right, or below the federal poverty line, you can't handle that crisis, that emergency that comes up about, oh my gosh, I need to get my car repaired. Oh my gosh, I got a $500 electrical bill. What am I going to pay? What can I not pay? What can I cut down on? So we're seeing that, again, that's folks are accessing food pantries. Folks are having to make the choice of, do you pay your full rent? Do you pay partial rent? Do you pay all of your electric bill? Do you go on a payment plan? But we're seeing the need now more too also through our neighborhood service program where we are able to provide some, small financial assistance when we do have funding available. But those calls keep coming, right? I can't tell you how many folks we talk to who say, my landlord raised the rent. I can't afford to be here. It's more than my income. Okay, let's try to find something more affordable for you. But I think that we're seeing it. I know here in Hartford, we're seeing it across the state. So again, we really want to always ensure that we are writing those grants, we're connecting with people, getting more funding to continue to support the work that we do as an agency and to be here for the community. We also have a supportive housing program here in the greater Hartford area where we also provide case management services to 110 households. And we continue to look for ways to ensure that we can, again, develop more housing that's affordable here in the greater Hartford area.
Thank you, Stephanie. I have just a few more resources I'd like to share with the group, and I'll definitely try to make sure there's room for questions. So if you or anyone you know is in need of food, this QR code leads to 211. This has information regarding the partner programs. You can find food assistance programs or other resources near you. You can also text Foodshare to 85511, where you can get the full mobile Connecticut Foodshare mobile pantry schedule directly to your phone. We also have a community resources page at Connecticut Foodshare that provides up-to-date, free or reduced cost community resources available throughout the state. We are often asked, how can folks help the work that we're doing at Connecticut Foodshare within the partner programs that we work with, like Stephanie, like Deirdre. So we have a few different links that we will add into the chat. Volunteering, anyone who's interested in volunteering at Connecticut Foodshare or any of the partner programs under the network can visit Connecticut Foodshare, the Volunteer Hub, to see volunteer shifts that are available both at Connecticut Foodshare's 3 locations, as well as the partner programs who are also looking for volunteers. We also have a donation link. And of course, we would be nowhere without advocacy and policy. We always strongly encourage that folks advocate. They talk about, what you've learned today. Share this with, other colleagues, other folks that you think might be interested in learning more about this types of information. And I would be remiss if I did not mention our upcoming Connecticut Foodshare annual Walk Against Hunger. This Saturday, May 4th at 8 a.m., we will be at Duncan Park. This is a free, family-friendly event. There will be face painting, balloon artists, tattoo artists, baby goats, a photo booth. So please, 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 if you are interested, we will add the registration link below, and we will also add it to the recording for anyone that's not here today. But again, please, we hope to see you on Saturday, May 4th at 8 a.m. And this is my last slide, just with our contact information for anyone who is interested in learning more information about any of what you've heard today. But I will open the floor for questions and just leave this slide up. And you are more than welcome to come off mute. We also have someone who is monitoring the chat as well. We have about 6 minutes for Q&A.
I just wanted to say, Aubrey, it was great seeing your face. You're doing amazing.
Thank you, Debbie. Hi, it's nice to see you again.
You too, sweetie.
So I see a question in the chat. I'll pass it off to our presenters to answer, but what is the status of Connecticut's supermarket food donation program? Are all supermarkets required to donate food that is past the sell-by date to soup kitchens, etc.? It's a great question.
That is a great question. I can take the first stab at it. So I know for Connecticut Foodshare, we have the Retail Rescue Program, where we do partner with larger retail stores across the U.S. to get the food that has reached its sell-by date, but not necessarily its expiration date. So it's still perfectly fine and safe to eat. From my understanding, that is not required for folks to do, but we do greatly appreciate the partnerships that we've built over the years with the retailers that are donating their additional food to us.
Yeah, we're very fortunate, right, to also participate in the Retail Rescue, where folks come in, drop off donations, which again helps supplement and also adds a little more to folks that folks are able to bring back home with them.
And in our Litchfield County, we have a food rescue group. I think there are over 400 volunteers that go out and pick up food from restaurants and grocery stores and deliver to food pantries, banks, and soup kitchens throughout Litchfield County.
And I may be speaking out of term here, but I feel like there's no reason why you can't ask your local grocery stores what they're doing and try and get them involved in the conversation. I know that that's something I've grappled with in my own personal life, so I feel like it's a good opportunity to open up the door for a conversation. But all right, thank you for jumping in on that. The next question I see here is, are there resources to help people get household cleaners and supplies?
Yes, that is a great question. So yes, Connecticut Foodshare is privileged enough to be able to offer both food and non-food resources. So when we are accessing, especially Retail Rescue, we also receive non-food resources. So hygienic products, diapers, baby formula. So it depends on the month and depends on our supply. But yes, we do receive non-food resources that we then do put out to our partner programs as well.
And we're also really fortunate here at Hands on Hartford, where we have folks that donate household items. We have a group of folks that are really good about like couponing, and they bring us like tons of stuff. So we're always very fortunate and thankful for those folks that donate to us.
And there are certain groups that go out and collect toiletries and things like that, that they don't necessarily ever donate food. They focus on the other needs of people.
So I'll often see Connecticut Foodshare, large truck, making deliveries at a soup kitchen when I'm volunteering. And my question is, I assume that food is not being donated. I'm assuming Foodshare buys it at a lower rate and is able to sell it to the soup kitchen at a lower rate. Is that correct?
So we do have a few different ways in which we procure our food. We receive food through donations. We also receive food and services, or resources, I should say, through federal programs such as TFAP, the Emergency Assistance Program. We also do purchase some food items. And because of that, we have what we call a grocery purchasing program, where we buy food at wholesale prices and then are able to then sell it to the partner program network at a certain cost.
That's great. Thank you.
Thank you, Michael.
Thank you all. I want to use this last minute with you all to just share that, like I mentioned at the start of this, we are, whoops, it jumped to the wrong slide. We are hosting a session every month now through through October, and then in November we have a conference. Our next conversation is going to be focused on the intersection of affordable housing and race equity. That'll be June 5th from, again, 10 to 11 a.m. Wednesday morning. We really hope to see you there. We will drop the link in the chat for you all to join and sign up to participate, but we are basically at our hour mark. I can't thank you guys enough, Aubrey, Stephanie, and Deirdre, for the time that you spent with us this morning, a really important conversation, and really grateful to be partners with you all in making Connecticut a better, healthier place to live.